the question that's on everybody's mind is whether they should be tested for COVID-19. As I speak to you today, on the 3rd of April, there's the National Health Service and governments and other small non-NHS laboratories to increase the testing capacity. At present, testing for COVID-19 is only going to be prioritised for essential workers in the NHS. It would be important to know whether someone has got COVID-19 or doesn't have COVID-19, particularly if they're isolating at home because someone else in the family has got symptoms or they've got symptoms, so that's negative. That means they could then come back to the front line if they wish to do so. And then the other form of testing is the antibody test, which is a blood test which would allow the doctors to know whether the patient has actually had COVID-19 in the past, and then you can see the signature of that in the blood. And then that again would mean that that person would not be at risk of contracting COVID-19 and conversely would not be at risk of passing on the disease to somebody else. And again, that would be very important to know that in particular in NHS workers. So what resources are there available for people with skin conditions, and if they have further concerns in relation to COVID-19? Well, certainly as far as psoriasis is concerned, the Psoriasis Association in the UK have produced very good information. There's information about from the British Association of Dermatologists, and so that is all available through the internet. It's important though to go to reputable organisations such as the British Association of Dermatologists, such as the Psoriasis Association for that advice, because there is a lot of spurious, unhelpful and sensational advice that's been given out across the internet and other media outlets. So thank you for listening to this video. I hope that this was helpful and helped to reassure you that we are doing everything we can to help you through this difficult time. There's people there to answer your questions. There's a lot of resources available to answer those questions. And management of skin conditions, as it is going to be for any other medical or surgical condition, is going to be very different over the next few months. But as always, though, we have your best interests at heart and also your health particularly. Stay well.